All right, let's get right into it. We're about to unpack a story that's, absolutely massive in scale, but also full of deep contradictions. On one hand, you've got this global healthcare engine, and on the other, a system that's really struggling to serve its own people. This is the story of India's healthcare paradox.
So, just to give you a sense of the scale here, let's start with the money. Right now, in 2024, the Indian hospital market alone is worth a staggering $180 billion. I mean, think about that. If this one sector were its own country, its economy would already be bigger than a lot of nations out there.
And it's not just about the cash, it's about the people power. India has the third largest healthcare workforce on the entire planet. We're talking millions of doctors, nurses, and technicians who are the engine behind this massive industry. But this is where it gets really wild. The projection for the whole market by 2025, it's somewhere north of $638 billion. That's not just growth, that's an absolute explosion. So the big question is, what in the world is fueling this incredible trajectory? Well, for starters, one of the main pillars is manufacturing. India is, and this is no exaggeration, literally the pharmacy of the world. It makes something like 20% of all generic medicines globally and supplies over 60% of the world's vaccine demand. Just think about that for a second. Chances are some medicine sitting in your cabinet right now actually came from India. And here's another huge driver, the cost. A heart surgery that could set you back over $100,000 in the US might cost as little as $5,000 in a top-tier Indian hospital. And the quality is often just as good. This incredible price difference has turned India into a global hotspot for medical tourism. So how did this happen? How did a system that was once mostly government-run transform into this global economic engine? Well, let's take a look at the timeline. You can really break it down into 4 key phases. Before the 2000s, it was a pretty basic government-led system. Then the 2000s hit, and you see this massive boom in the private sector. Fast forward to 2018, the government launches Ayushman Bharat, the biggest public health insurance program on earth, which totally changed the game for the poor. And then, of course, the pandemic after 2020 just forced this massive leap into digital health. And speaking of the pandemic, get this. The hospital market's value shot up by 113% in just the 3 years that followed. It was a terrible crisis that, weirdly enough, ended up supercharging investment and growth across the entire industry. Now, that whole success story is powerful. It's real, but it's not the whole picture. And this is where we get to the tale of 2 Indias. Which brings us to the most important question of all. With all this money, all this growth, and all this global recognition, who is this world-class healthcare system actually serving? This chart right here lays out the problem pretty clearly. A whopping 80% of India's doctors are serving the 32% of people who live in cities. That leaves just 20% of the doctors for the other 68% of the population out in rural areas. I mean, that imbalance is just staggering. And then you have to ask, who's paying for all this? In India, almost 55% of all healthcare costs are paid directly out of pocket by patients themselves. Just for comparison, that number is 35% in China and only about 11% in the US. What this means is that one serious illness can completely wipe out a family's savings. Yeah, the challenges here run deep. The country needs over 1.5 million more doctors and 3 million more hospital beds. Public spending is less than half of what experts recommend for universal coverage. And then you've got this huge group, about 350 million people, they call the missing middle. They're not poor enough for government help, but they're not rich enough for private insurance. They're just stuck. Okay, so the problems are massive, no doubt about it. But the efforts to try and solve them are pretty massive too. Let's look at how technology and some big government projects are trying to close this gap. So that huge government program, Ayushman Bharat, it really rests on 3 main pillars. First up, you've got a massive insurance plan covering over 550 million of the country's poorest citizens. Second, there's a huge network of wellness centers that bring free primary care right to the village level. And third, there's a big digital mission to give every single citizen their own unique health ID. And this part is a real game changer. It's called e-Sanjeevani, and it's the largest government-run telemedicine platform in the world. It uses simple video calls to connect a patient sitting in a remote village clinic directly with a specialist doctor in a big city hospital. It's a brilliant way to try and bridge that massive rural-urban doctor divide we were just talking about. And has it worked? The impact is just immense. By mid-2025, this platform had already handled over 372 million remote consultations. Think about that. That's hundreds of millions of long, expensive trips to the city that people didn't have to make, and you can only imagine how many lives that's affected.
So, you've got a booming market, you've got these deep systemic challenges, and you've got these really innovative solutions all happening at the same time. So, what's next? Well, the future is definitely uncertain, but it's also incredibly promising. If you look at it from an investment angle, the story couldn't be clearer. Just look at these returns. If you'd put 100 rupees, that's a little over $1, into Max Healthcare just 5 years ago, you'd have 768 rupees today. That just shows you the insane level of investor confidence in where this sector is headed financially.
And looking forward, there are really four big forces that are going to shape everything. You have an aging population, which basically guarantees decades of demand. You have technology like AI and robotics that will completely change how care is delivered. You have big hospital chains finally expanding into smaller cities. And of course, the sector is set to become an even bigger creator of jobs.
And that really brings us right back to where we started. This quote just nails it perfectly. It's an industry of extraordinary, unbelievable promise, but it's one that's still fighting these deep-seated, fundamental challenges. So I guess it all boils down to this one question. India has proven it can build a world-class, globally competitive healthcare engine. The defining challenge for the next decade is going to be whether that exact same engine can be tweaked, can be re-engineered to deliver quality, affordable care for all 1.4 billion of its citizens.